And then Vin, do you want to wait a couple minutes to get started, like 12:02,
Yeah, that sounds good.
like we did before? Everybody, welcome. If you're just joining us, I see a lot of people joining who are off camera and muted. So I'm going to assume you're running. You logged in and you're running to get a bite to eat, and then you'll be right back. We'll get started in 2 to 3 minutes. And welcome. If you've just joined in the last minute or so, we're just waiting for everybody to arrive. We'll start at about 12:03. And if you wanted to take this moment to make sure that your Zoom name has your name, your affiliation, and if you'd like, you can include your pronouns. And if you haven't done that renaming before, it's the upper right-hand corner of anybody's picture, actually. Right, no, your own picture, and then click rename. Okay, just like we'll give people another 30 seconds. We've got kind of a constant stream of folks who are on their way in the proverbial door right now. And if you've just joined in the last minute, just want to invite you to update your Zoom name that kind of shows in your window using those 3 dots in the upper right-hand corner of your own picture, and click rename. And then if you wouldn't mind, please make sure your name and your affiliation are there, and your pronouns if you would like. Okay, let's just wait another few seconds because we still have a pretty good inflow. Okay, Vin, I think it's time. You okay if we get started?
Yeah, that sounds great.
Okay. Hi, everybody, and especially to those brave souls who've turned on their video. Here we are again. This is our 3rd of 5 Buildings Working Group meetings. So today our theme is health and resilience. So welcome to those of you who might be new to this room. And if you would like to see what you missed at the first 2 meetings you're in luck, I'm right now going to put into the chat a link to the YouTube stream, and that has both the kickoff event and the first 2 meetings. My name is Marty Frank. I am your facilitator today. So my role in this group is to keep the train running on time, so to speak, and you are all here to provide input into this policy that the city is working on. So we are asking you all today to speak to your values, speak to the vision that you have for buildings in Portland, speak to your questions and your expertise. So just a quick recap of where we are. So in our very first working group meeting, we focused on learning. We talked about what building performance standards are, where else they're being used, how they can work. Then in our second meeting 2 weeks ago, we talked about renewable energy. And we heard from 3 of our local utilities about the sources of and plans for providing increasing amounts of renewable energy to Portland. And we heard about some key concerns around renewable energy. We heard about concerns around cost, scalability, reliability, resilience, ownership, and location of where those renewables are. And 2 weeks ago, we also dove a bit deeper. I'll ask you to mute yourself too for the moment. Thank you. A couple weeks ago, we also dove a little bit deeper on the structure of policies like the one we're here to talk about. And we heard some things from you. We heard about a desire for flexibility, right? That many of you would like to see kind of a both and approach to this policy design, something that will be adaptable to the different circumstances on the ground and also be attentive to avoiding unintended negative consequences. And we also heard from you that you still feel like you need to know more. So there were a lot of requests for data, right? Data on how different policy approaches might produce different outcomes. And so to that end, I wanted to let you know that the city this week has begun holding office hours. So you can come and talk to Vin and others one-on-one, and I'm going to put that into the chat right now. So your next opportunity to come to office hours is tomorrow at 10 a.m. So moving all the way through mid-June, the city is available to you Monday afternoons for an hour and Thursday mornings for an hour. Okay, so before we dive in today, I want to turn again to the subject of the tenant working group. So this is the other working group that's meeting in parallel with this one. And I'd like to ask the facilitator of that group, Irene Kim, to let us know what they talked about at their meeting last week. Irene?
Hi, everybody. Good to see you all again. And for those who are joining for the first time, thanks for coming. Okay, so I'm going to share some highlights of the last tenant working group meeting, which I've been facilitating over the past couple of weeks. So the topics we focused on was around temperature and indoor air quality. So we asked folks, about what kind of access to cooling do you and your community need, considering current barriers like higher utility costs and landlord pass-throughs of investment costs. So asking, do folks prefer cooling day and or at night, having only one room cooled versus the whole unit, thoughts about offsite cooling centers versus onsite. So a lot of folks, a common theme was that a lot of folks would like to see at least one cooled room, but also consider households with multiple generations and more than one family in a unit. Access to cooling needs to both day and night. We all know that nights can be equally as brutal with heat or with high temperatures. And then also a lot of comments around increasing urban canopy to provide more shade and address heat island problems. And also prioritizing on-site cooling for folks with mobility issues or otherwise folks who are unable to travel to a cooling off-site cooling center. And then there were also ideas about providing other critical services such as childcare and maybe other types of wraparound services like healthcare and workforce services at cooling centers as well to make it a little bit more versatile and holistic. And there are also lots of kind of stories and experiences around really people weighing decisions between either paying higher utility bills or their own and deciding between their own health and well-being. So a lot of emphasis around being able to provide financial support and incentives to implement some of these building improvements and providing support for our most vulnerable populations. And then we also talked about air pollution and sort of indoor air quality, and also what types of information that renters will need to know to make good decisions about air pollutant health risks before renting or signing a lease. So I think an overwhelming common theme was that more information is power. So and Dr. Erika Moseson provided a lot of really great information about, things like leaving the fan on for 20 minutes after cooking, how that is helpful for indoor air quality, the impacts of gas stoves and cooking food to indoors and things like that. So there are got a lot of comments that a lot of people were learning a lot of things that they didn't know before. So, things like providing a simple checklist for renters of building conditions to look out for when looking for units, requiring building owners to disclose utility costs to prospective tenants, and like what their heating, cooling, and ventilation systems are like in the building. So things like that, I think, were just common sort of ideas and thoughts that came out of that session. So I'll stop there. Sorry if I went too long, Marty.
Oh, no worries. We're good on time. Trains are still on time today. So as you all heard, the topic of the tenant working group last week was health and resilience, and that's the topic of our conversation today. And so in a way, Irene perhaps has given you a bit of a preview of some of the topics that may or may not come up today. So I accidentally hit return before Irene talked, but if you look in the chat now, you will see our agenda for today. And like last week, today is structured in a pretty similar way. So we have really two big pieces on our agenda. The first is on health and resilience standards. We'll talk more about that in a minute. And the second is on temperature standards. So in each piece of our agenda, we're going to start with some short presentations and provide you some information. Then we'll have a short Q&A with the presenters, and then we will have small group discussions. So we'll be in small group discussions again twice today. And we will absolutely take a short break in the middle. So some kind of quick reminders. Please keep yourself on mute unless we're in discussion mode. I want to suggest hiding your self view and putting yourself on do not disturb, two really good ways to help kind of focus in on the conversation. And I invite you, as always, to use the chat to pose questions and reactions, as well as any of those other reaction buttons that you have available to you. And if you have technical issues, Wing is the person to private message about this. Okay, so turning to introductions, we are going to do this in the same way that we have done it previously, which is using the chat. So if your Zoom name does now include your name and your affiliation and your pronouns, you can leave that out of your chat introduction. If it doesn't, you can include that. And I would like to invite you to just share with the group a question that you have pertaining to this subject matter, not, like what is the meaning of life? Is there a question that you brought with you today? Or something maybe that's kind of left over from last week, something that you're thinking about or wondering about related to this policy. I'll just pause a minute and invite you to enter that.
How do you chat on the phone in Zoom?
Oh, hi, I can hear you. Are you on the phone? Was that somebody on the phone speaking up?
Yeah, that was someone on the phone asking how to use chat on the phone. I'm not sure there's an option, actually.
I will do this. I'm going to put my email address into the chat. Oh, but you're not on the chat. You could email me, marty@efficiencyforeveryone.com, if you can get that, and then I can stick it into the chat. Oh, if that was David, he figured it out. Excellent. Okay. I'll give you guys just 30 more seconds if you want to share a question or something that you've been thinking about or wondering about. Maybe some kind of like unresolved issue for you related to this policy.
Just a reminder, there is the office hours as well.
Mm-hmm. Okay, well, feel free to enter that at any point, and I will turn it over now to Vin to introduce for us. I'll turn it over to Vin to introduce our first topic of the day and our first guest speaker.
Great, thank you, Marty. Are we going to do introductions in the chat too, so everybody knows who's in the room?
Yeah, most people I think have have updated their Zoom names to have their name and affiliation. But if there's something else about yourself that you would like to let everybody know, if it's your role or something about what you do, you can feel free to put that in the chat as well.
All right, thank you, Marty. And I will start sharing here. Right. How's that looking?
That's great.
Okay, great. Just going to move a few windows out of my way here, including the chat. All right, thank you everyone for joining us for the third session of 4 for the building working group. And as Marty noted, we'll focus on health, resilience, and temperature standards. We'll start off with health. I'll provide some kind of just getting us grounded in the base knowledge, and then turn it over to Dr. Erika Moseson, who's a pulmonary cardiologist, to share more detailed information on healthy indoor air. So today, out of the standards we're looking at, so also known as the HEART standards, health, equitable energy, anti-displacement, resilience, and temperature. Today, we are focused on improving health and indoor air quality within our buildings and building resilience to wildfire smoke. And then as part of resilience, we'll look at setting maximum indoor temperature limits. Okay, so starting off with the health piece. So we're not looking at all aspects of indoor air quality or health. We are looking for the intersections between reducing carbon emissions, so that could include increasing energy efficiency, the ventilation, and indoor air quality. So we're looking at the intersections there. For instance, we know that during the pandemic, there was an effort to increase building ventilation. Generally, carbon dioxide is a proxy for indoor air quality. And the idea was to decrease the amount of carbon dioxide, so meaning more ventilation to have prevention of the COVID specifically from being transferred within our buildings among people. And so that's one area of intersection. Unfortunately, that also generally means, unless there's heat recovery ventilators within there, that means more energy use. More ventilation means more fresh outside air. And if it's cooler or hotter outside, then we need more heating or air conditioning. So that's an area that increases carbon emissions. And if we think about energy efficiency and trying to increase energy efficiency, that generally means more sealing, which is not necessarily good for reducing the transmission of airborne diseases. It's also not good for mold and radon that can be present within buildings. So there are some technologies to get around that, like I mentioned, heat recovery ventilators. And so that's something to think about. And then within the buildings themselves, we can have combustion byproducts. So sources of that can be from our stoves for both residential and commercial buildings. Other sources can be wood stoves or fireplaces. There can also be backdraft from furnaces. And then lastly here, I'm pointing to wildfire smoke, which ideally is on the outside of buildings. But if we have our ventilation turned up, or if the building isn't sealed well, the envelope can leak in wildfire. Or if we open our windows because it's hot during a wildfire event to cool off, we could allow for smoke to enter into buildings, and then we have a risk of wildfire smoke within our buildings too. So those are some of the intersections. We'll have some breakout discussions. Maybe there's more that you're thinking of, but just to kind of orient us around some of the I think, well-known intersections between these three areas. Okay, so when we think about air pollutants indoors, I want to orient us to be thinking about not just our own experiences, but also the experiences of those who are most vulnerable. So children, pregnant women, older adults, pre-existing heart and lung disease, and then low-income and BIPOC communities who are generally exposed to more air pollution, whether indoor or outdoor. So I wanted to cover a few of the pollutants that we're considering here, and there could be others too. So again, breakout groups, I encourage you to bring others to the attention of the group and gave us some feedback. But three that we know of that are directly related to the fossil fuel combustion within homes are carbon monoxide. So unlike carbon dioxide, similar, very different gases though, both invisible. Carbon monoxide, also known as CO, is acutely toxic, versus carbon dioxide does not have any toxic effect on us as far as I know. But carbon monoxide causes dizziness, confusion, chest pain, unconsciousness, and death. So an example of where that's happened with deaths is where folks may use a propane heater or a natural gas stove or oven to warm their homes when there's a power outage, and the carbon monoxide is what's usually causing the death when that happens. So some examples of where that comes from, I mentioned a few of those: wood stoves, natural gas cooking is another, tobacco smoke, and again, outdoor air pollution if it seeps in from the outside into the interior of the building. Similarly, nitrogen dioxide is another combustion gas from fossil fuel combustion. This one is more of a long-term effect, not acute, and so it can have some acute symptoms of respiratory irritation and infections, but the long-term are aggravated asthma, and as well as contributing to some cancer concerns. And so similar of where this comes from is carbon monoxide. It's from fossil fuel, but also wood stoves are biomass or renewable biomass within our homes. There can be other sources as well from just any combustion. And then particulate matter. Here I'm noting PM10 and PM2.5. This is the 10 and the 2.5 are referring to the size of the particulate matter. And this is of concern because PM2.5 is small enough to enter into the pores of the lungs and then go directly into the bloodstream. And depending on what's on that particulate matter, the toxicity varies. Like if the particulate matter from diesel exhaust, for instance, outdoors, can have polyaromatic hydrocarbons that are carcinogenic, so that they can present other toxic exposures too. But generally, PM2.5 is known to cause heart attacks, irregular heartbeats, also aggravate asthma like nitrogen dioxide, decreased lung function, respiratory irritation, and premature death. So both acute and long-term effects. So just to note that with PM, there is particulate matter that comes from natural gas combustion, but there's also particulate matter that comes from the cooking on stoves. So that can be either from electric or natural gas, and otherwise it's the same list that I have above. So let's go to an example of a standard. So there is currently a standard for carbon monoxide in Oregon, where rental homes and really all homes need to have working carbon monoxide alarms. That is lightly enforced through the fire departments in Oregon, but not regularly enforced or routinely enforced. So some of you might have carbon monoxide alarms. They are required by energy code right now too. I think they're less common in existing buildings, but that is a state standard that exists. Okay, with that, I wanted to stop sharing here and turn it over to Dr. Moseson. Are you set, Erika?
Hello, sorry, I'm trying to close my patient chart so I don't do a HIPAA violation here. Hold on, sorry. Okay, good, that's closed. Okay. I'm gonna share my screen. Where are the screen shares? I'm apologizing. I usually see it at the bottom. There we go. Okay. Okay, can people see this or do I need to swap screens?
We are seeing your left-hand side too. So it looks like it's not in presenter mode.
Okay, so if I do, does this work? Are you seeing it?
Yep, that looks great. Thank you.
Okay. Well, thank you for having me here. My name's Erika Moseson. I'm a pulmonary and critical care doctor. So it's lung and ICU. My cardiology friends would say I'm no cardiologist. And I am based in, I work predominantly at Emmanuel and out in Gresham, you know, talk about healthy air. So this is, the mandate was kind of, you know, healthy air in 15 minutes. So obviously it's a huge topic, but this is kind of a brief overview of what I'll try to cover. The big thing, I think the best analogy to really understand these things is because when you start to hear about like air pollution and people start diving into all these different compounds like PM 2.5 and ozone and sulfur dioxide, nitrogen dioxide, and all these things, basically just, my slogan of a lung doctor is don't light things on fire and breathe them into your lungs, right? So this is I actually put it on a t-shirt, and this is a picture of my sister with like the wildfire smoke raging outside. And I think just cigarettes are just a really good analogy to understand this. So it's like, if you think about all the things that we find out that smoking causes, basically, breathing combustion from anything is really the source of those illnesses, right? So, and this is really kind of disease womb to tomb, right? So, pregnant women exposed to ambient air pollution get premature and low birth weight children, just like with cigarettes. You get these asthma attacks in kids, you get air pollution exposure causing asthma and obstructive lung disease in adults. Ozone can cause emphysema in adults, just like cigarettes can cause emphysema, right? You have these, MRI changes in children's brains that you can see related to air pollution. We have all these studies about kids on high emitting diesel school buses that, that are particularly vulnerable. And then as they clean up the engine, the kids, absenteeism goes down, their cognitive performance improves, their, lung function improves, all those things. So I think kind of just thinking about cigarettes is just a helpful analogy, right? So and then the other thing that's kind of helpful thinking about cigarettes is, it used to be we'd kind of think, oh, well, yeah, maybe if you're smoking 3 packs a day, but if you're not smoking or you live with a smoker, that can't be a problem. And it probably is turning out that it is. So I think, when people think about air pollution, killing people, I think people think of these big dramatic events. I don't know if people watch The Crown, that Netflix show during the pandemic when we're all streaming Netflix, but there's this very famous episode that's dramatized there called The Big Smoke, right? Where this inversion just kind of trapped the city's air pollution, and people died. So you had this large spike in pollution. So this is the spike in pollution, and you had the spike in the death rate, and it went up. And just like with smoking cigarettes, it doesn't go right back to normal once you quit, right? It went up and then it stayed high for quite a long time after the pollution started to go down. And so people say, well, kind of like with smoking, yeah, well, that's like smoking 3 packs a day, but, the air looks clear, it's not as bad. Surely that can't really be an issue. And it turns out it still is. So this was a really large, there's many studies on it, but this was a really large one in the New England Journal, looking at over 60 million Medicare beneficiaries, kind of in the earlier part of this, the 2000 to 2012. And they just kind of basically looked at the zip code, the annual ozone and PM 2.5 and ozone averages, and just kind of looked at all-cause mortality, which means like, how much did they die? And then looked at kind of the risk of death associated with the increasing levels of pollution. And they controlled for a whole host of things, and including, Medicaid eligibility, all sorts of covariates, all the demographic things you would think about. And it turns out that there is this linear increase in the risk of death, and both, PM 2.5 and ozone. And most importantly, that this kind of that secondhand smoking analogy, that this is actually it's the exact same risk increases when you're even looking at air quality that in theory meets what were the previous, EPA standards of, like 12 or so. It's actually, which is why the WHO has recommended moving lower. And I think, the American Thoracic Society has as well, that, these, people just die more. And the reason is it's very like cigarettes have a whole host of effects, but for example, the particulate matter, one of the reasons we care about the size is, when it's the PM 2.5, when you inhale it, it's like inhaling, just why people inhale drugs, right? That's why people inhale cigarettes. You inhale it, it gets instantly across the little tiny membranes in your lungs into your bloodstream and circulates all around your body, causing disease, and it can kill you. So even at these levels that we, previously were hoping weren't harmful. And so that's why I just kind of say it's no smoking, right? And so this study looked at, when it was looking at air pollution and death, this is kind of all comers, right? So everyone died more for each increase in the PM 2.5, right? But some people were more affected than others, right? And so, for example, maybe there was a slight protective effect for women, maybe they're inside more, maybe men are outside working more exposed to this. Whiter populations were more protected. And then you see some very, disproportionate effects, for example, in the Black community that aren't just explained by socioeconomic, factors and everything. And then you have people who are like more eligible for Medicaid were slightly more affected, but not as dramatically. And this brings up something that we've been, talking about, where redlining, right? You kind of have an experience of redlining the air. And so for people who aren't familiar, although I guess people in real estate would probably be maybe more familiar, you have this, kind of history in the United States of the federal government through the mortgage programs, prior, to the later part of the century, actually kind of segregated the United States. You ended up with kind of wealthier populations in areas with, kind of cleaner air, and then areas with communities of color being in, lower value land. And then that's where kind of industry gets placed, right? You put the freeways there, the factories there, and everything where the land's cheaper. And again, you're thinking, well, is this still an issue? Well, unfortunately, it still is an issue. So here's a study from 2014 where they looked at 5,000 children and looked at, how close they were living to freeways, right? Freeways and high traffic roads. And this was looking at, Hispanic children, right? So Hispanic children are more likely to live kind of close to the freeway. And then, the more Native American ancestry they had, they were the people who lived closest. And so they were much more exposed to oxides of nitrogen, to nitrogen dioxide. And the reason nitrogen dioxide is such a bad actor is it's really associated with asthma, worsening asthma, airway disease, all these things. And so, so again, being closer to the freeway meant that these kids were, much more exposed to nitrogen dioxide. And then they were over twice as likely to have ever reported asthma, almost close to 4 times as likely as the populations living farther away. And so there's multiple studies on nitrogen dioxide and asthma in kids and everything. And so basically what we need our homes to be is a clean air refuge, right? So you want to filter out the ambient air pollution. And then obviously this, I think we all remember from, the fires of, 2020 from that east wind event, right? We really actually have to make these really clean air refuges, because even just dropping your AQI to half, down to, 150 to 200 is not going to cut it, right? So we really want to make sure we have a clean air space, pollen, all those other things that we have to, deal with in the air. But then we also have to think about kind of air contamination, fires inside the home, right? So the biggest, issues are, kind of what we classically think of as our personal habits, right? Smoking cigarettes, vaping, all those sorts of things. But, fires, wood burning, cook stoves that are, venting into the space. We might talk about coronavirus, right? So that's, that when we're all exhaling virus around each other, if we're not making sure to ventilate or filter the air, that can kind of build up to pretty dangerous high levels. And then we also think about things like, gas appliances and, fire that we're actually lighting in the home to like heat and cook and everything. And so, a lot of this stuff generates PM 2.5 inside. A lot of nitrogen dioxide is notorious for associations with gas appliances. And so here's some different studies. There's a whole host of them. And I don't have time to go through all of them, but I can touch on a few, and there's plenty of references if people want to look at them. So one study looked at, gas appliances in homes. And since I know we're, and this was looking at, basically, if there's an electric stove in the home or a gas stove in the home. So around 482 versus, 246 homes that this is their kind of, heating source or their cooking source. And so the kind of the ambient background here was around 20 parts per billion. And so the homes with electric stoves just were much more likely to come in under that number, right? So much lower levels of concerning nitrogen dioxide levels. And then homes with gas stoves were just much more likely to have the higher levels. And then the question is, okay, so they're higher levels, but does that cause any problems? And it turned out it did, right? So if you're the home having the gas stove be there, you had kids who were much more likely to have wheezed, and anything that's bolded is significant. Wheezed, have shortness of breath, chest tightness, versus not in a gas stove. A gas dryer was also kind of significant in terms of episodes of shortness of breath. And then that, kind of looking at that, if you're below 20 or above 20, did that, does this kind of really matter? In terms of, these episodes of chest tightness, which is something, that we really kind of worry about. And this was, for a multifamily house. So what do we do? I mean, that's kind of hard, right? Because, there's, you put gas appliances in, and I have a gas stove that we kind of just bought when we got our house and everything. So there's, different stuff, and you want to kind of do things, everything has risks and benefits and trade-offs, right? So there was one study that looked at a school that was heated by gas heaters. And they looked at kind of just basically, do we replace the heaters? Basically they replaced half of them with electric or not to see if it really kind of made a difference for the kids. And so the kids who had the heaters replaced actually had a dramatic improvement in trouble breathing during the day. So this was looking at, kids with asthma in a school. And so they actually, by over half, in fact, down to a third, had episodes of trouble breathing during the day, including night. So nighttime is a big issue for kids with asthma. And even at night, it was dramatically reduced. Episodes of daytime asthma attacks, and everything like that. So it works to replace it. So then the other question is, do we, ventilate or filter? So, the hard part, I think people are probably familiar with this table, is looking at, there's kind of like, as a doctor, I can tell you when you're trying to bring like the human element in, it gets a little trickier, right? Because people have to use things, right? So if you install something, you got to use it. And so there's kind of the things you need for kind of electric stoves and stuff for handling PM 2.5. But when you're getting to gas stoves and you're really generating a lot of nitrogen dioxide, and the hard thing with nitrogen dioxide is you don't really usually smell it, right? So it's not something that's going to be bugging people. You really have to get pretty high airflow, and you have to have people, these are like kind of the instructions we tell people to do, is you got to have it running for like 10 to 20 minutes afterwards. You actually have to be cooking on the back burners, which a lot of people don't really want to do. You're also having to have people kind of maybe change what they're actually cooking with and covering their pots and pans. There's just like a lot of human behavior stuff. And we know, like, American patients get like a C in terms of using our medications correctly for a whole host of reasons. So it's just, there's these issues with, trying to have people do this. So kind of looking at real world studies. So there was one study that seemed relevant for this group, which was actually looking at existing rental housing and basically randomizing people to get either their stove replaced, right? And this was all kind of grant funding. They were just the organization replaced the stove, had contractors who'd like installed it, did the whole thing, looked at, basically you don't really have to have any adherence issues, right? It's just, that's changed what you're doing. They also installed, the other option was installing 2 air purifiers. They put one in the kitchen, one in the bedroom. These were HEPA filters with an activated charcoal component, which would get gas phase compounds like nitrogen dioxide. And that's kind of good because it's kind of a catch-all, right? Works for wildfires, works for virus, works for everything. And then they also had a ventilation hood that they did, and they installed that. And then with the issues, they kind of got to turn it on, right? So these were kind of the 3 things they tried. And then they looked at the nitrogen dioxide levels in the homes, in the kitchen and in the bedroom, right? So here's the kind of baseline. And so anything that's got a star by it is significant. So replacing the stove obviously worked, right? You dropped your, you stopped generating nitrogen dioxide in the home. And so your stove, the electric stove really worked to drop that down. And then, the other thing was the air purifier, which also worked. That was a significant difference. I mean, 19 to 15 is not as significant, but it's significant. So it seemed like people were kind of willing to turn those on. Maybe they're quieter. The interesting thing is the hood really didn't do too much. And so, which is just interesting. It's in both of them. It wasn't technically a significant difference. So I'm not sure if people just felt like there's a hood, so they felt that therefore, it was being taken care of or something. And so I'm not sure if it was just a usage issue, but it did have the airflow was like 220 on it. So, it had the capability of doing some pretty reasonable airflow. And then, and this is in the bedroom, similar thing, right? Because even it's just interesting to note how high nitrogen dioxide can accumulate in the bedroom, a dramatic fall just by replacing the source of the nitrogen dioxide. But again, the filters did a pretty good job. And then again, the hood statistically did nothing. So this just kind of brings up things to think about in terms of when we're thinking about housing, right? So I think they talked before, like weatherizing, obviously super important, helps keep that air pollution out, helps with heating and cooling costs, helps keep everyone's costs down. But just remembering that kind of comes with a risk of what's inside can't get out, right? So whether it's virus, carbon dioxide, which can make people feel uncomfortable and at very, very high levels, which are not usually generated by people, but can have bad effects, PM 2.5, nitrogen dioxide, that sort of thing. And then other risks, right? If you've got a home that's got, a radon source under it, if you kind of weatherize it and trap everything down, that can be an issue. Moisture accumulation can lead to mold. And so just kind of really important to make sure we've got the adequate ventilation and filtration of the air in the home and trying to minimize indoor sources of combustion. Obviously, cigarette smoking being like number one, but other, things like, gas appliances and making sure if they're there, adequately ventilated, et cetera, et cetera. So you just kind of need these multi-pronged interventions, and especially, including things like, HEPA filters and stuff, when you're thinking about, wildfire episodes. So I just kind of remind people that, our homes breathe too. So just kind of thinking about the outdoor air and what's in it, and then the indoor air and how we can work to kind of keep that clean. Because that's where people spend almost 90% of their time actually is indoors. So, so I know that was really fast. It's an immense topic. There's tons of information. I find myself talking about these things over and over again with my patients. So I've got, an educational resource, if you're interested, called Air Health, Our Health. And then I've got, there should be a PDF that will be sent out that has all these references if people are interested. So please, yes, I think I came in under 15 minutes.
Dr. Moseson, thank you so much. I think you get the award for packing the most information into the shortest period of time, at least of anything I've heard this week. So I want to open the floor for questions. Can we focus on clarifying questions? Are there kind of like, I don't know, data or technology or health specific questions that you would like to pose to Dr. Moseson? And I would say feel free to raise your hand or note it in the chat. Sean, thank you for demonstrating the hand raise. Do you want to go ahead?
Sure. I saw in the discussion of weatherization, have you seen any studies that actually show air quality going down with building tightening? I've heard it suggested that it actually goes both ways. Drawing air through your envelope just actually makes it worse, not better. So I'm curious, since you've got so many sources, whether you've been able to come across any specific research.
I think that's a good question. I'm not sure, but it doesn't mean it's not out there. I just might not know. It's funny because I feel like so much of medical research has always been like focused on the individual and their behaviors, and now we're kind of learning a lot more. I think it also depends on what people mean by weatherizing. So I think that's a thing that's tricky. I know we've got plenty of studies with like PM 2.5 that show sealing things like can generally improve the air quality if you're not burning things inside. So I think it's always, you just have to be very specific on what someone means by weatherize, right? So if they mean sealing up their house without having any ability to like ventilate, you know what I mean, versus if do they mean weatherize in like a holistic approach where that's kind of put into the planning. I think someone in the working group had said a really good phrase of like mold is a symptom, not a you know what I mean? Like that it's like a sign that there's a problem, not that there's not the actual driver or something. So yeah, so that's, I guess that's, if I don't know, I'm not familiar with a study that would show that, because I think when you're looking at medical literature, weatherize is such a non-specific intervention. We do know that as you do improvements for your house, for example, you might want to repeat radon testing or something. Like if the house used to be super leaky and drafty, you seal it up nice and tight, you just want to make sure that you're not now trapping radon and need to interfere with that, or intervene on that. But I guess here the answer is no. I'm not sure of any study that would show that.
Thanks, Sean. That's a great question, especially for those of us who've been working in energy efficiency for years, and I think have been like solely focused on tightening houses, and not necessarily thought, a huge amount about kind of what some of the potential negative consequences could be. We have a couple minutes. I want to invite other questions, clarifying questions, technical questions. You want to dig deeper into any of the studies that Dr. Moseson pointed to? I know stoves and gas stoves has been a really big topic in climate change circles recently. So if there are questions about those.
Marty, David has a hand raised.
Thank you so much. I didn't see that. David, go ahead.
Yeah, thanks. Can you hear me? Can you hear me now?
I can hear you.
Marty, can you hear me? Oh,
I can,
great.
I can hear you.
Yes,
for the study with the NOx reduction, I was wondering if they also tracked any other pollutants, like it'd be especially interesting to know if they tracked PM 2.5 on that one as well.
That study was a NOx study. That one was a nitrogen dioxide study. There's another study, a randomized controlled trial study looking at people with like COPD, randomizing them to get sham HEPA filters with carbon cores versus not. And they found, and because that was looking, I think, I'm pretty sure they looked at both NO2 and PM 2.5 in that study, and because they were putting in HEPA filters with activated charcoal. And in that one, it was a pretty dramatic RCT, because you look at it was like a $500 HEPA filter that had honestly the same effect over like 6 months as like, thousands of dollars worth of inhalers, where they actually showed, decrease in both of those pretty effectively with the HEPA and the charcoal filter, and then also decrease in like exacerbations of COPD and, worsening of disease. So it was a pretty good study.
Okay.
Before we go on, Erika,
you.
could you clarify HEPA, RCT, I think you said, and COPD, what that means?
Could I clarify? Oh, so there's the filters are like the Wild West. Like anyone can kind of like make something and claim that it make claims about what it does to the air, which is kind of interesting. But there are some certifications. So in general, you want to have a filtration system in your home that the way it works is it moves air past a filter and stuff is pulled out of the air. So there's all sorts of people, I'm sure very well-meaning, who make all sorts of claims about like putting ions and hydrogen peroxide and all this stuff into the air. And that by doing that, they're going to make the PM 2.5 glom together and fall down. And a lot of these are based on these things where they ionize air inside a shoebox or something, like a shoebox sized chamber, and then extrapolate. And it's really hard to know if that's real. And then so studies on like whole buildings of those things are limited, but the ones that have been done are not that promising. And then just the other thing from like a lung doctor is like, you don't want to be inhaling anything that you don't really know what it's going to do to the indoor air chemistry. So things like HEPA is a high efficiency, particulate filter. Those are like usually the portable ones you can get, and they're amazing. Like they can really take out like virus, wildfire stuff. You just kind of have to get it sized for your room. So they should all come with a CAT or a clean air delivery rate that you can size basically for the space you're trying to clear. But that works for particulate matter. So gas phase compounds are so tiny that those are not affected by a HEPA filter. And then you need something like charcoal, or but that certainly increases the cost a little bit, or not a little bit. It can be significant. But that's also, I think, getting a bit better. But so, for example, from a cost standpoint, like with electric cooking, a lot of times you're dealing more with particles, like as people burn things, right? Like in their toaster or on the stove, you don't have as much of the NO2. And so sometimes then the filter solution can be a bit cheaper. Like you're not having to do a HEPA and an activated charcoal filter. You'd probably be okay with a HEPA filter. And then for the homes, like if you have like a central air HVAC system, usually you're looking at filters that are on the MERV rating. And those would be like 8, 11. And again, I'm not an HVAC specialist, so I'm sure you have HVAC. This is like the building group. I feel embarrassed like talking to you guys about this, I'm sure. But like from like whenever the lung doctors are talking about it, like something like a MERV 13 can get you to some filtration things like a HEPA filter. But a lot of home systems or the HVAC professionals say that that's often too much of a drop for a home system to handle. But again, I would completely defer to, the HVAC specialists on that. But again, that idea is like a mechanical filter through which air is moving and then the particles are being pulled out, not something that's putting stuff into the air and then making claims about what they do to the indoor air chemistry that makes things fall away.
Thanks. That
Yeah.
helps clarify that HEPA and or HEPA and MERV, MERV are filtration rating systems. But just an acronym soup, if you could just state what COPD is. Or anything.
Oh, I'm so sorry. Chronic obstructive pulmonary disease. So like when people talk about something having like emphysema or chronic bronchitis. Yeah, sorry.
Thanks for that. We have a couple more questions. So I would love to pose Dr. Moseson a question from the chat, and then we'll just take one more live question, and that will be from Brendan. And then if you have your hand up and we don't have time to get to you now, I would invite you to kind of bring that question up in your small group. So the question from the chat came from Molly. And Molly was saying that she has a gas stove and she opens a window when she's cooking. And then she says, is this something that needs to be in a PSA? So Molly, you could go ahead and speak up if you like. I'm curious your take on that, Dr. Moseson.
Well, I think if you can open a window, if that's your only option, then I would do that. I think, it's hard. I mean, like, so I think the Lawrence Berkeley Laboratory studies this the most. If again, I feel I am not an engineer. I want to be really clear. But like what they've looked at when you're trying to actually get the clearance over the stove, like to clear that gas up, that you want it to get that, like you want to get like around like I think 85% clearance rate or something like that, that you need to really do that. Realistically, people need to know to be, trying to basically not have a lot of emissions coming off, cooking on the lowest heat they can, using the back burners, and then running that fan, the ventilation fan, the hood for like 10 to 20 minutes afterwards. And the hard part is it's kind of a hard question to answer without knowing sizes, right? So, in these houses, these like giant, if you have like a giant single family home with like 3 stories and none of the bedrooms are on the first floor and it's huge, right? That NO2 is going to dissipate more than if you're in a small multifamily building with like apartments next to each other and everyone kind of cooking at the same time and maybe everyone's not running their fan. So there's it kind of a lot of it depends on the size of the dwelling. Sometimes kind of maybe what other people are doing, right? And so I think it's hard. I mean, if you don't have a fan in your home or a hood, I mean, I would definitely open a window and I would, maybe get, that filter worked pretty good. Maybe get a HEPA filter with a carbon core.
So like I've never really trusted my ventilation hood. No, and I live in a townhome and it's it's not a super size by any means, but I've always just cracked a window. and sometimes cross windows, just, while I'm cooking anyways, just because I don't want the smell upstairs. But I do think that there's some like tenant behaviors that, we can encourage more of and just be more aware of that. Like you said multiple times in your presentations, our homes are breathing. And so reminding people that, yes, early in the morning when the temperature is low, open your windows. Get some fresh air in your house. And at night, just a little crack, doesn't have to be a lot, but just get some fresh air in your house. And constantly doing those kinds of things helps, no matter where you are. Now, I know that also from what you said too, I can appreciate you're not going to do that when you live near a freeway, or you're somebody who has, residences that are taking into that. So I certainly empathize with
and with our asthma
patients of situations.
And because like for asthma patients, like pollen burden changes a lot during the day. So there's times where we're telling them to like close the windows, and so that's where it's like I think if there's the best thing is if you have like an HVAC system, you know what I mean? Like if you're like in an area where it's like you actually have the outdoor air continuously being brought in, but filtered, right?
Mm-hmm.
Like, and so that you do have your building kind of breathing, I guess would be.
Yeah, definitely at all times. Well, thank you for that.
Thanks, Molly. Thanks, Dr. Moseson. Okay, Brendan, I'm sorry, I'm going to have to ask you to hold your question to small groups because I don't want to cut short that conversation time. So this is now the time when we're going to break out for our discussion. So like our previous meeting 2 weeks ago, each of your groups will have a facilitator. So you'll either be with Vin, Andrea, Dirk, Irene, or myself. Once you get into the breakout room, we'll start with a quick round of introductions, and then we'll put the question into the chat. I'm going to give you a preview of it this time, and I'm going to quickly share my screen and show you a couple of other things before we break out. Okay. Vin, can you give me a thumbs up? You guys seeing this correctly?
Yes, looks good.
Excellent. Okay, so the first thing we wanted to share with you before we break out is just a reminder of the values that we are operating from in these conversations. So this is the Wordle that we did last week. So these are the values that are driving us in this work. And I want to flip quickly, hopefully, yes, to the values that the tenant working group also shared, right? I think we have a lot of commonality in this. We're, as a group, very much focused on equity, health, justice, community, resilience. Also wanted to remind everyone of the BPS ground rules, right? So I'll just pause for 1 second. My personal take on these is that, and if you could mute yourself this time, thank you so much. We're really thinking about listening as much as we are speaking. Really helps facilitate, I think, a meaningful conversation. Okay, so what are we going to talk about? Here is the overall purpose of this small group discussion. So we're really thinking towards standards that are helping prevent exposure to air pollution in buildings, right? All of those bad things that Dr. Moseson and Vin just talked about, right? How do we prevent those from happening? And so you'll see kind of the two questions that we're going to focus our discussion around. And we want to acknowledge that the second question on building standards, maybe there might be fewer people that can speak to that. So we are going to move into those groups. Wing, would you like to zap us away now?
Hi, Jenny. I see you still in this main room. I can't seem to move you to a breakout session. Are you there or is it a weird glitch?
Hi, everyone. Welcome back. Just wait a couple minutes. So nice to see all your faces before you quickly turn your videos off. Only joking. You're free to turn your video off. Okay. We are going to do a quick report out now that we're back. And I apologize. We were trying to give us like 4 or 5 more minutes in those small groups, and we weren't able to do that. So if there were things left unsaid, you are welcome to put them in the chat to everyone. You are also welcome to put them in the chat to just one person, so your facilitator or the person you feel most comfortable with. We don't want to lose any of those things that you kind of had on the tip of your tongue before you left. So I'm going to ask each of the group facilitators to tell us about kind of the key themes from your group. So just about a minute each. Vin, would you go first?
Sure, thank you. Okay, so some key themes here. We mostly focused on the first question. There wasn't much experience with standards. There was a question I'll get up to about standards in a minute here, though. Yeah, so some folks had either switched to induction stoves. Those are magnetic electric stoves from natural gas, or have one on order. And that's a way to just eliminate the, not necessarily the particulate matter from food cooking, but eliminate the carbon monoxide, nitrogen oxides indoor. And then there was an idea of, that was used during the wildfire smoke. It sounded like a cool retrofit hack called, or taping HEPA filters to a box fan and running it continuously. And that probably took some smoke smell out of the air, at least. Not sure if it had an impact on health. And then noting that hospitals are heavily regulated for air quality and through ventilation, and that they have their own industry accreditation. So they have their own industry regulators that inspect. So I think we can learn some more in depth about how that works, and for the standards we're looking at for the city. Let's see. One person then had installed a new hood ventilation system because the old ceiling fan wasn't doing anything, and also eager to replace their stove with an electric. And then another person noted that they have negative air pressure coming down their chimney from the old wood stove, and so they're switching to an electric insert into their fireplace. And I think that was about it. So lots of ideas in there. There was a question, where does the city regulation fit into county and state regulation for health standards? It happened to be that Brendan Haggerty from Multnomah County Health was in our room, and so we will work with Brendan, continue to work with Brendan on determining where is the right level of jurisdiction, and what's been covered, what's not been covered at the county and state level. So just want to follow up on that. And then I will note that Brendan's question was, are there indoor air quality standards out there? And so Dr. Moseson, there was one of your slides, I had the same question where it's a study of rental housing costs for stove replacement, and there was an air quality threshold. So in the background, if you could drop into the chat if you have that answer, or maybe just the study that we
no, that was just the ambient, that wasn't a threshold. So the hard part is, that's where I was using the smoking analogy. So the like, you can find a linear relationship with asthma exacerbations even with like an NO2 level of like 10, you know what I mean, like like those lower, like it's a linear thing. That's where it's kind of like, I use the smoking analogy where it's like so it's not like there's this thing where it's like, oh, below this threshold there's no problem, and then above this threshold it's a problem. It's all kind of linear. So then the EPA set standards based on outdoors. And so, I mean, you can look up what the NACS stand, it's the National Ambient Air Quality Standards. That was just kind of, they just looked at like background NO2 on average in homes there. And I think, I can't remember what's,
no, it's
I can't remember if it was, I think it was in a city. So I think probably it's like a higher background level than like if you were in a rural area.
I'm following. I don't know if everybody else is, but I'm following. I think Brendan's probably following too, that it's the National Ambient Air Quality Standards.
And some of those like are getting ratcheted down. I mean, like for example,
can we keep going? We're going to report out, but I'll follow up with you directly. Yes, okay. Thank you.
Okay, thank you both. Andrea, we have just a couple minutes. So Andrea, maybe like 30-second report out on your group key themes.
Yeah, some similar themes. Some folks had switched out, to induction for cooking, and felt that was like a very aha kind of, wow, this is really a cool thing. Some experiences like trying to balance like filtering and air conditioning and not having great experience with their equipment functioning correctly. Just this learning that that sometimes venting isn't actually going to the outdoors, and that's a big thing that folks didn't know. And then just how much, you know, of certain things are out of people's control, like around buildings, you know, like I think this is like when you're trying to talk to people about individual behavior change around what they're putting in their own bodies versus like what's happening around them in their buildings that they don't have as much control over, and how hard that can be to influence. On the second question, a little bit of experience with living building and well buildings, and just a noticeable correlation between buildings that have those standards and increased comfort and pleasantness to be in. Oh, and one last thing I think is really important. This the feeling of ventilation and energy efficiency sometimes being at odds because they're, you know, you've got to increase your energy usage to get ventilation, but it's not an either or, and we need to be talking about these things together.
Mm-hmm. Thanks. That came up in our group as well, as the contrast between those two, or potential conflict. Irene, what about your group? Just 30 seconds, quickly summary.
Yeah, we had pretty much all, whatever came up just now was all the things that we talked about as well. There was one person in the group that installed energy recovery ventilators, ERV, which worked really well. And also some thoughts about that gas stove hoods don't work well anyways, and so that's been an issue. You know, replacing filters frequently, cleaning out ducts, indoor plants, HEPA filters, all of those things are things that folks have been doing. And I'll stop there just for time.
Thanks, Irene. Dirk, what about you?
Yeah, I've been trying to find the new things as folks go along. I think some things that were mentioned in my group were around employee education. So employees of this organization have been trained in LEED and well training for the buildings that they work in, groups of janitors. There was a comment about thinking more broadly and thinking about things, VOCs and things that come from building materials as well as are a concern, not just what's coming from cooking or these things are a concern. And cradle to cradle type focuses. Red lists are a good resource to look at things. And I think that comes from the Living Building Challenge. Yeah, thanks, Marty.
Okay, thank you. And the one thing I'll add from our group is we had a couple of folks in our group who manage or deal with portfolios of buildings, and this understanding that in many cases, these buildings are going to be really different, right? So the challenge for a building owner of needing to have different strategies for different buildings in their portfolio rather than like a one size fits all solution for improving and protecting air quality. Okay, thank you everybody for your participation and for staying with us. We're going to take a 5-minute break. We are going to leave now. I invite you to turn off your video and mute and come back at 1:23. See you back here, 5 minutes, 1:23. Hi, everyone. Welcome back. Just wait a couple seconds. Hey, David, for everybody to pop back in. Right. Just I'm doing the same thing. Finish chewing, chew and swallow during your 5-minute break. What was that your parents told you about, like not eating too fast because it gives you a stomach ache? Okay.
And don't go in the pool.
And don't swim right up. I guess when you're an adult, you can violate those rules anytime you choose. Okay. Thanks, everybody. I hope you had a restful 5-minute break, got some food or whatever you needed. We're going to turn now to the second topic for today, and that is temperature standards. I view these as kind of like the sibling of the IAQ issues that we just talked about. And I'll start by turning the floor over to Vin. We're going to go through the same format. We're going to be presented with a bunch of information, and then we'll do some Q&A, and then we'll have a second small group discussion. So Vin, the floor is yours.
Thank you, Marty. All right, let's see here. How's that looking? Good. Okay, so I'm going to frame. Can folks see this? Can somebody confirm? Okay, thanks, Lorraine. Okay, so whoops, backwards, got ahead of myself. Okay, so I'm going to frame the temperature standards in a kind of resilience, climate change resilience frame. And so when we think about resilience, it's not just temperature. There are other components too that are intersectional, like wildfire smoke. Often the wildfires are happening during heat waves. We get these big east winds off the mountains, and they're bringing smoke down into us. They also bring the threat of the wildfires themselves, like in September 2020. And so there sometimes decisions have to be made around, do we open our windows at night and let the smoke in to cool off, or do we keep it closed and then deal with the effects of heat stress that are now affecting health and well-being? So just pointing that out, we need to look at resilience holistically too. We are going to get more focused on temperature. But we know, and this is a summary, I've gone over the Oregon Climate Change Research Institute information before. This is a summary from Multnomah County's recently updated Regional Climate Health Report, that we expect climate change events to get worse. Poor air quality that we're just talking about, spread of diseases, extreme weather events, heat waves like the heat dome. Just noting too that we also intersectional with this is the issues of inequity. So systemic racism and discrimination, and justly distributing the impacts and burdens of climate change among those on the front lines, including low-income people and communities of color. And then one specific example from this report is thinking back to that September 2020 wildfire event. The emergency department visits went up for asthma-like symptoms by 29%. And on top of that, it was hot out. Okay, and then bringing us to the current heat dome, which slides not advancing, there it goes. Not the current, but the most recent, the June 2021 heat dome, that is a mass casualty event. It's on par for some of the worst heat waves that have ever been recorded. 62 deaths in Multnomah County. On top of the deaths, there were lots of heat-related illness and hospital visits due to heat stress. To give you some context, I mentioned before that the record in Vegas was 116 degrees. 117 degrees. On June 28th, we actually got to 116 degrees. But Vegas, they're accustomed to that kind of heat. Here, we're not really accustomed. This graph is showing the variation in temperature throughout the year. The top there is showing the previous record at 108 degrees, and the 3 dots are how we broke that record 3 times in a row, 3 days in a row during that heat dome. And then some more context here. Just over the last decade prior to the heat dome, there were only 2 deaths related to heat waves. So that was clearly a very extreme event. The city and to the county had a response to the heat dome before it happened and while it was happening. So some of those examples are providing space where people could cool off, doing outreach to seniors and others that are vulnerable populations to heat stress, like those experiencing homelessness and folks with disabilities. and a lot of communication on extreme heat risk. And I hope that everybody heard about that. And so the city, certainly, we had lots of emails flowing to us because of the work at the Portland Bureau of Emergency Management and the Multnomah County Health Department. The county health department also opened up 24-hour cooling shelters for the first time in their history, including the Oregon Convention Center, downtown area, Arbor Lodge in North Portland, and Sunrise Center in East Portland. In addition, during the daytime hours, the libraries were offered as cooling spaces for air conditioning and water. So the city and the county continue to do a lot of planning for future heat domes now. That's not something we're covering by our policy. So for building standards, we are looking at what can we do for folks who are inside their homes, where the city and county emergency response will often say shelter in place. And so what can we do for folks who are actually staying in their homes during these heat events, which can be coupled with wildfire smoke events? One thing to consider before we go into our breakout discussions is, I've showed this before, but for folks who are new to these working groups, is there's an uneven distribution of heat across the city. It can vary by, here this is shown in Celsius, but it can vary by 20 degrees Fahrenheit across the city. For instance, this is showing the variation in a warm summer afternoon, and during the heat dome, the measurement at the airport for the high was 116 degrees on June 28th. Dr. Shondas, who provided this data to the city to map at PSU, measured physically himself out at Lentz 122 degrees around 3 in the afternoon. So it actually could have gone much higher in Lentz too, because there's a lot of trapped heat from asphalt that is in parking lots and dark color surfaces that are absorbing heat during the day and then re-releasing it, especially at night. So that's called the urban heat island effect, something else to consider. And then just a couple examples of where areas that are cooler, like out in Goose Hollow, where there's a lot of green infrastructure, and even around freeways, compared to the east side, where you have these darker red colors. This example here is over by 205. That's actually Portland Bureau of Emergency Management's office there. Notice that the asphalt, there is a little lighter color of not of asphalt, but concrete there for the parking surface. Okay, and I just wanted to share briefly some examples of what's happening in other cities that go through extreme heat waves that we might want to start preparing for. And that's part of what we're considering these temperature standards. So for instance, Dallas has a maximum temperature for rental housing at 85 degrees Fahrenheit. That's during their warm months only. And so there needs to be at least one room within a home that is maintaining 85 degrees or less when the outside temperature is over 110 degrees. So it's just during those extreme heat events. In Phoenix, there's a limit of 82 degrees. They do have an option there for 86 degrees with evaporative cooling because of how dry it is there. Evaporative cooling is like, maybe you heard of swamp cooler. If you blow a fan over water in a dry climate, it will actually cool down a space as well. Maybe not as applicable here. Other side of the Cascades, yes. So in this case, the landlord provides cooling of all habitable rooms and bathrooms with permanently installed cooling facilities. So it can't just be like a window air conditioner. Then Washington, D.C. has a 78 degree limit only if there's already air conditioning, which is kind of a weird incentive not to have air conditioning. But yeah, it's much lower, much more humid there, I think is the reasoning behind that. And it's also relative to how hot it is outside, and again, for those summer hot months. So those are just some examples I wanted to share of what we're seeing in other cities. And we want to dive a little more into understanding how they arrive at those temperatures. But for us today, I would like to, before we jump into our breakout discussions on temperature limits and experiences around extreme heat indoors in our homes, I wanted to introduce Oriana Magnera from Verde about a Senate bill that passed this last legislative session, Senate Bill 1536, working with some of the folks who are in our room here today. So I'll turn it over to you, Oriana, to share what that bill does and what it doesn't do that we might want to consider in Portland.
Thanks so much, Ben. Really appreciate the opportunity to be here today, and gratitude to the many folks in this space who helped to pass the bills I'm about to speak to. So Before we talk about what's in the bill, I want to speak to what happened statewide. Because there's a reason we went to the legislature and didn't just do a City of Portland ordinance related to cooling, which is that at least 96 people passed away across Oregon. This is not just a Portland issue, not just an urban issue. Rural communities were impacted as well. And we know that this number probably grossly undercounts the number of people who are impacted in health manners by the heat dome, but also who passed away because these deaths only were counted for the days the heat dome was in effect and not conditions that came into play and required people to be hospitalized for days after the heat dome. So I think that's worth noting and just putting this in broader context. So the heat dome occurred on the last day of the legislative session in 2021. And a number of legislators' districts were impacted, as you can see from that previous map. Verde community members were impacted. Many of you had community members or tenants who were impacted by the heat dome. We knew that we needed to do something to address a couple of different issues. One was just increasing access to cooling and addressing some of the barriers, including the resource barriers associated with cooling devices like air conditioners, which are a life-saving technology if we're being honest. But because air conditioners also have some downsides from an environmental perspective and also from a safety perspective, in terms of falling out of the window for window units, we also wanted to address heat pumps as well. And that long-term access to an efficient cooling model that can reduce energy costs, reduce energy usage, and not add load to the system, and also be more friendly for the environment. The other issue that came up in the heat dome was a lack of clarity in the landlord-tenant relationship associated with air conditioners. Some leases prevented people from installing air conditioners in their units. Some people tried to do that. And cities like Mayor Beatty in Beaverton got called in to mediate a lot of relationships and trying to figure out what the rules were. So we wanted to create some clarity about the situations in which a landlord could prevent someone from having an air conditioner, but also to be more expansive and say, ensure that someone could install an air conditioner even if it looked a little bit unsightly, that it really came down to health and safety issues for the building, for other tenants, for legal issues that would come up. And we'll get to that in a moment. But the bill first provided $5 million to Oregon Health Authority for emergency air conditioner and air filtration deployment. This is distributed through community-based organizations and will be available this summer. I was just talking to OHA earlier today, and they're hard at work figuring out procurement so that they can make these units available probably at the end of June. They would be available in emergency situations like the heat dome and available to distribute to communities. Landlords who have tenants on OHP or the Department of Human Services, healthcare that's available for folks who can't access OHP for various documentation reasons are eligible as well to distribute these units to their tenants. There's also $10 million for heat pumps prioritized to low-income and environmental justice communities. This was especially targeted at rural communities who utilize bulk fuels like oil, propane, and wood stoves. And then there's an additional incentive associated with $50 million specifically for landlords to install heat pumps. And this piece, both heat pump incentives can be utilized to address some of the mechanical and electrical issues that come up when installing a heat pump and adding that kind of electrical complexity to a space, or in the case of a lot of multifamily buildings, messing with some of the air pressurization systems in hallways. So we wanted to make sure there was resource available, not just to install the unit, but also to address some of the upgrades necessary as well. One of the things that 1536 does, as I mentioned, was remove barriers for renters to install portable air conditioners. Scenarios in which a landlord could continue to restrict installation of an air conditioner on leases would be if it blocks an egress, so it would interfere with fire code, make the unit no longer ADA accessible. For buildings that have really old wiring, if adding a number of air conditioners would short the building out and mean that no one could have access to cooling or refrigeration, or if it would cause some sort of fire danger. And then another issue that comes up is window units falling out. So window units can be restricted. in situations in which they might cause a safety hazard, but floor units can only be restricted mostly for the electrical reasons or if they are blocking an egress. So that's significantly reduced from the practice that was previously in place, where it was more broad across the board. And this was extended to condo associations, homeowners associations, and historic resource code can't prevent air conditioners from being installed as well. So we covered landlords in terms of the scenarios in which they wouldn't have control over the rules in their space as well. And then cooling is required in new construction, starting in 2024 to address permitting issues. And the Department of Energy will be collecting data about the costs and barriers associated with converting affordable housing to include cooling to help set the stage for what's the longer term work we need to do to acknowledge that Oregon's climate is getting more like Dallas and Phoenix in some ways than we would like to admit, and that we need to install cooling. Then the last piece is $2 million to the Department of Human Services to expand the air shelters that they were already doing to include cooling and warming shelters, and $2 million for landlords to set up voluntary cooling centers, especially for those landlords who have buildings with the electrical issues and their tenants couldn't have air conditioning. They might have a common space they could cool, or a partnership with a local church or community center, or they could help install cooling either at a temporary or more permanent basis and have a space for people to go that wasn't one of the larger congregate shelters, which have a lot of concerns for people, especially during a pandemic last summer. The last thing I'll note before I take a couple questions, if we have time, is just noting what the bill doesn't do. It doesn't establish a right to cooling like Phoenix or Dallas or Washington, D.C. Landlords are not required to provide cooling in any part of the building, nor have a requirement to keep temperatures below a certain amount. It does not mandate access to cooling centers beyond what is provided by local government, so it doesn't require landlords to provide cooling centers, and it doesn't address health and safety issues beyond cooling. So this is a start to address cooling access, but there's a lot more work that needs to be done from a cooling perspective or a health and safety perspective. And Vin will send out these slides as a PDF, along with a one-pager that breaks down some of the same information. Unfortunately, I don't have a lot of information yet about how to access the programs, but I'll provide it in that one-pager where it's possible.
Thanks, Oriana. That's great information. I think it was really helpful when you talked about what the bill does do and what it doesn't do, to kind of draw into sharp contrast some of the things that Vin had talked about earlier, right, that we're seeing in other cities. So we absolutely have time for Q&A, and welcome any and all questions for Vin and Oriana. Thanks for hanging out for a few more minutes. Oriana, and you are welcome to raise your hand using your reaction buttons, or if you would like to go ahead and put your question in the chat, and one of us will take a look at that and can read it out loud. Okay, Shaylin, yes, please, go ahead.
Yeah, hi. Sorry, and I was recently in a meeting with you as well, so this probably won't come as a huge surprise. When you're talking with housing providers that have really large portfolios, for example, over 100 properties, is there any conversation yet about financial assistance for the project management aspect of even doing the work to figure out what the upgrades look like for a portfolio that size? Because I mean, for us, honestly, we had a conversation last week, and we couldn't identify who in our organization had capacity to take on that large of a project, because that is very much a full-time project management position to just look at what those upgrades would look like across our portfolio. So any assistance in that area?
Yeah, so we had initially intended that question to be part of the ODO study of just identifying those barriers, but we recognize that there are a lot of housing providers like Home Forward who want to do this work sooner, and that it is really significant. So there are two potential pathways, one of which I can confirm. I can go talk to the Department of Energy But I believe that through the technical assistance dollars related to some of the upgrades associated with installing a heat pump, that could include the project management aspect. What I need to confirm with Odo is whether if you decide not to install heat pumps or air conditioning, you could still access those dollars. Originally, the bill had been a $10 million fund for heat pumps and a $5 million fund for everything else. And Odo wanted it to be one thing to reduce their administrative cost. But the original intentionality was to have like this other resource to address all of the things that come along with installing cooling. So I will get back to Odo, send that information to Vin to send around to this group. But if it turns out that Odo is not able to accommodate, we do have another legislative session coming up. Verde is looking at continuing conversations around cooling, mostly related to green infrastructure. And we could probably roll into that bill some clarification if that is needed for the 15 million, or try to seek out some additional resources to help housing providers to answer the questions that it sounds like Home Forward is already asking, which are really complicated, difficult ones that shouldn't have to wait for a state study to be answered.
Great, thank you very much.
Yeah, thank you for that question. I want to point out that Shaylin, your question about planning and resources to support that type of planning that's required across a big portfolio of diverse buildings. That's something that actually came up in our last session as well. And this question of what are different building owners or portfolio owners' capacities to do this planning work. And so I want to also kind of contrast the example you just gave about Home Forward, right? And this kind of who in the organization has the time to do this. You know, want to contrast that with the experience offered by another owner of a portfolio of buildings who said, well, any project as big as perhaps, right, installing cooling or something comparable, you know, there would be the resources available because it would be a relatively small cost compared to what the organization would already be putting up to do the work itself. So I kind of want to open up that there are likely a diversity of experiences out there when it comes to capacity for planning. I just want to offer that to anybody else if you have thoughts on your organization's capacity to even think about and prepare for this work. Anybody have another experience or insight they would like to share on that topic?
I think that might be directed towards me. So in working with Verde and the coalition that brought forward this bill, and in discussions with Vin and Andrea, one of the things that I think that Home Forward pointed out is significant is realizing that when we talk about like literally gutting some of these buildings that are 50 years old to address the cooling issue, it is not a simple task. It is a huge, big deal. It isn't just window air conditioners. It's replumbing every unit electrically to a different grid and putting in these heat pumps. And when you add in the labor and time, it is a 6-month project in a city where we also have to realize too that owners have to pay, you know, a 3 months relocation fee on top of every tenant who's displaced in the process of putting in this type of a cooling system. This is not these are just realities right now. I would like to believe that these are things that we can work through. But I think there's some pretty hard and fast feelings around those things that make it difficult to have meaningful conversations. But this is a space where, you know, we do need to have a project team that includes partnership with the city, partnership with Verde, Energy Trust of Oregon, owner operators, and really getting everybody on a page and pulling it together and saying, okay, if we're going to start this in this building on this day, where are we going to put these tenants for the period of time it's going to take to do this work? Can we get it done in a realistic period of time? And especially with, you know, things that are outside of our control, but also factor in, which are things like access to the supplies, the materials, and the people. You know, once you have them here, you have to house both the workers and, you know, the families that are displaced through this process. So I just put this out there that there's definitely desire amongst members of my association to begin this process. There's just some hard realities that we have to work with. We want to have these conversations to make this happen. And, that's why we partnered with Verde and the rest of the coalition to figure out where can we make this work, where some maybe creative or innovative approaches that we can bring to the table here. I hope that's not offensive to folks by saying all that. I'm just trying to be completely transparent and honest about this complicated situation.
That's really helpful, Molly. And that anecdote I relayed earlier was not directed at you. So, but maybe it rang true, right? True for multifamily property owners, right? Diverse buildings, really different strategies.
And because I represent a diversity of people within the association, I appreciate Home Forward coming from, to the table with their question, because definitely they're a huge portfolio that's part, I have members that manage their properties, and, they're paying attention to this and they're asking me questions too. So there's a lot of things that are happening behind the scenes that maybe people aren't aware of, that are, people are trying to find some path forward. And it's both politically difficult, and there's some issues around where can we put people during the time that we're doing this, when's the best time to do it, and how do we make all these things happen so that you have the least amount of disruption for everybody.
I appreciate that. I've for sure noted that in my notes. I think something that is kind of a what needs to be accounted for I put it in the what needs to be accounted for bucket, right? And potential negative consequences. So thank you for bringing that up. I noticed we have 2 more questions. We have.
Hold on, Marty, for just a second here. I do need to provide some answers. I think this is really helpful, I think, to have Oriana here to speak about the state experience. And this is a different process that we're in, and it's still in the nascent stages. So right now, our engagement right now is with organizations. So Home Forward, Housing Oregon, Multifamily Northwest, BOMA, and many others that are here that are advocates, I think, to address both health and resilience and temperature, as well as energy and climate change. And so we are meeting organizationally, and it's really to help refine what the policy concept is. We're not married to any particular timeline or any particular technology. We're learning more. And so this is really helping us to hear this discussion, especially on unintended consequences around displacement. There are a lot of discussions that have already happened. We'll learn more about them in our next meeting around implementation, about the potential costs and higher rent, and then how do we address that. But I think you're really getting something here, Molly, of like, and this actually, David Hessel, I see your hand up, but I might take up the rest of the time here to make sure I'm answering these 2 important questions that came up. But David brought up, if the standards on carbon are too significant, like if we use that absolute emission limits, if anybody remembers which policy structure that was, that it could be such a long stretch for apartment buildings that are already on the margins, that they might just decide, that's it, I can't continue to have this apartment building, I'm going to sell it and redevelop it. And what's the embodied carbon footprint that comes from that? What about the displacement of folks? What's the impact on the market if we lose rental housing on the overall market housing affordability? These are all like key parts that we need to consider. And so I do want to point out just one big difference between what the Senate bill that did pass 1536 this last legislative session and the Portland Clean Energy Fund HEAT response. Those are looking at immediate, how do we address a potential heat wave coming this summer? So like 12 to 15,000 units is the goal over 3 years, starting in June, for the Portland Clean Energy Fund, PCEF. And that's delivering portable heat pumps to the tenants that they can take with them. So what we're looking at is a policy that would take us to 2050. So this is a very long-term policy with, I think, some big jumps to 2030 as much as we can to address climate change, but also some resilience around it. The tenant working group, a lot of what I heard in the feedback in the report outs and our follow-up debriefs internally have been that it just, the most immediate need is one room cooled per family. And so that's different than saying a heat pump for the entire unit. That's very different. And so, a window unit might be the solution to that for one room. And so I don't want to make assumptions that we're actually getting to the end game in the next few years. But yes, out to 2050, is there a way for us to plan ahead to maybe have air cooling for an entire unit? Maybe that's something that we should put on the table. So just consider timelines as we go into the next meeting, which will focus on implementation. We just like with carbon, we start off with an initial incremental progress, but the final progress is still many years out. And really the standards we're looking at aren't on the same timeline as the heat relief bill, SB 1536, or the piece of heat response. They're focused in the next 2 or 3 years and delivering dollars to get immediate response. It's an emergency heat relief. Our focus is actually probably not even having the first standards become applicable for at least a few years. So just wanted to clarify that. And then one last thing here is on engagement to really refine the policy further. So we do have a regulated affordable housing focus meeting that will be planned. And so right now we're looking at, well, let's explore what the standards are. Let's get feedback on that. And then in terms of the implementation side and financing cycles, funding cycles, that's something we really need to work with folks, especially large portfolios. So I really appreciate the question, Shaylin, for Home Forward, and as well for Housing Oregon for CDCs. And I think we need to think about that in the private market too, and coordinating with Multifamily Northwest, with BOMA, to really figure out, well, how does this implementation function on the property owner side? Because we are speaking organizationally right now. We need to really hear more from private property owners and public regulated affordable housing developers.
Thanks, Finn. I also put in the chat like a link to what Medicaid reimbursement looks like for air conditioners, in case people in this group didn't or weren't aware of that. If you have, like, we're aware of it in multifamily, that for tenants that are members of Medicaid, they can have access to air conditioners. It prioritizes based on in terms of their health first and foremost. But we put out to all of our members to make sure that tenants are aware of this, and that was already in place at the end of April. So I'm hoping that most of the tenants in the tenant group did get some type of notification, and if not, I'd like to know about that. And certainly if they're my members, I have a conduit in which I can directly deal with that type of lack of communication as a whole. But just putting that out there for the group as well, that we are trying to first and foremost make sure that our tenants are safely housed and as comfortable as possible, knowing that there's definitely other conversations that we need to have about how to do this better.
Yes.
Thanks, Molly. And Vin, I think your exchange, and I saw, David, you pulled your hand down, but put a couple comments into the chat, and so I'll just give voice to those quickly. And it's something that came up actually earlier in our breakout group, this question of portable sources, right? And portable sources as a stopgap measure, portable sources is something that can be used in an emergency, and something that renters could bring with them as they move locations, and that are perhaps, well, certainly less invasive, a way of providing cooling than the scenario that Molly described earlier with getting an entire building and displacing people for 6 months. So I think that's another important topic that I see threads of kind of through the conversation today. Well, we have another chance to talk about this, and we have a couple of specific questions. So before we go back into small groups, you should wind up in the same group that you were in previously with the same other people and facilitator. And so we can this time dive right into the discussion. So hopefully you are all seeing our questions for small group discussion number 2. So here we're talking about standards that promote health and well-being during extreme heat events. I think we've already started to touch on some of those relationships between outdoor air quality, indoor air quality, and temperature. But here we're wondering, first of all, what have you done, right? Or what have the occupants of your buildings done to keep them safe or keep them at least a bit cooler during the heat dome, right? We've had a recent experience with an absolutely extreme event. What did you try, or what did your occupants try? What worked, what didn't? And then we're also curious about what types of things have you been doing to upgrade your buildings to keep people comfortable in future extreme events? What was the general cost range of those things? How did you pay for them, right? What is the work that is already taking place? So Wing, I think we are ready. If you would go ahead and open the groups, and we'll
Hey, Wing.
Hey, I randomly threw you into a room because were you in a room before and I put you in a different one?
Yeah, if you can pop me in room 1, that'd be great.
Okay. Wait, you were just in room 2.
That was in,
yeah, sorry about that. I
Don't
thought
worry about
as soon as I hit the button.
No worries. No worries at all.
Okay, here we are again. Okay, we can continue our discussion here until everybody else comes back. I gotta send them a message.
It's probably better we left. I was going to go off on a whole monologue about our property tax system distribution. You know, I was going to say, Aaron, I can guess what part of the city you live in and where you don't live if you're paying high property taxes, because there's some really inequitable distribution around that, including, you know, commercial properties, not necessarily multifamily, but kind of underutilized space that pay very low tax basis. So yeah, I don't think we're here to solve our property tax system, but it is important to think about those things and the pressures that it has when we're trying to solve other problems that end up, you know, harming renters and harming folks that are, you know, already struggle with housing stability, for example.
Mm-hmm. Yeah, definitely. I learned a lot about like how just moving over one zip code can change the amount and change your car insurance and
yeah. And congratulations.
Thank you.
I wanted to, something I thought of last week after this question was what would happen if we had the landlords and the energy companies work together in business instead of the energy companies coming individually to each home and dealing separately? Would that cut cost, and would that create a space where the tenant is protected? So when your rent goes up, your electricity goes up, like you have more of a business model creating those circumstances instead of just, you know, the energy company saying, all right, we going up 7% this year. The landlord would be able to step in and say, we already, you know, put this burden on these folks. Can we wait till next season? Or, you know what I'm saying? So get more of a business to business instead of a mainstream person trying to make these movements on their own. And I just want to hear from the tenant group what kind of benefits or issues that they would find in that kind of option.
Mm-hmm. Mm-hmm. I would like, Anjana, I'd love to hear more about that. I think everybody's going to start coming back in. So if you have the desire to expand on that thought, I'd love it if you did that and stuck it into the chat. You could put it just to me, Marty, in case if you want. You could also put it to everyone. They might be like, I have no idea where this is coming from because they weren't part of the previous discussion, but I think you're pointing to something that that Hal and others talked about earlier, which is we have structural issues that some of these fixes aren't going to get us to. Okay, welcome back, everybody. Just wait a second as I see people popping back in. We'll do a quick report out again like we did last time, so we can each hear a bit about what went on in other groups. I'm going to ask my fellow facilitators to keep their report out to about 30 seconds, just so we have time for Vin to kind of close us out with some forward-looking thoughts on next steps. So Vin, 30 seconds on your key takeaways from your discussion.
Sure. Yeah. So we did have a couple of folks that had central AC, and then some folks who had window units. And then we noted that a lot of low-income folks move from place to place so often that they would normally have just focus on easier and simpler solutions that don't require large investments on their end. So referring to tenants. We did talk about a little bit about the high costs of heat pumps and whether or not panel upgrades would be included in those cost considerations. And we talked about cooling centers a bit as well. And during the heat dome that there was one person at Central AC was out of town, and friends started asking for access. So there probably is a need for cooling centers, and then that there wasn't much demand for the cooling centers and during the heat dome, but if there is demand in the future, how are those decisions made if there's not enough room? Like how do we decide who gets in, who doesn't get in? And then generally we talked about outreach and how important it is to have a community outreach plan for folks to know that the city and or the county are there to help out. And one quick thing, we talked about box fans being useful until we have extreme heat where like the indoor temperature is above body temperature, then they're no longer useful. All right.
Okay, thank you, Vin. Andrea, 20 seconds, go.
Very much the same themes, more about like cheaper, easier, quicker kind of hacks, if you will, like not hacks, but, like sitting in a cool tub of water. People that won't run AC even in 116 degrees because they're worried about cost. And the fact that the cooling shelters were really insufficient in the sense of they're too big, they're too centrally located, they're not at the neighborhood scale, and folks who can't travel or elderly are not going to go to them, and how big of a role social isolation played in the folks who died in the heat wave, and how to start solving for that with more community connection. And social media and media alerts are not going to get to those folks.
Awesomely fast recap. Thank you. Irene.
Yeah, we talked about very similar things. Night flush can be really effective, but has limitations when it comes to when there's really bad outdoor quality. But yeah, similar to Andrea, kind of the cheap and easy techniques, like just having a wet cloth on you with fans blowing can be effective. But also going easy on AC use. I think, or there are thoughts about having temperature set at like 75 degrees instead of most people have it at 69 or lower. So being cognizant of that. And then are we doing the second question as well, Marty?
Well, right now we have 2 minutes left. So I'm going to say no, but maybe if there's something important to share, stick it in the chat so people can see it. That'd be great.
Just one last thing to mention is there's also talk about like neighbors helping neighbors networks. So making sure that folks can support each other in that way.
Thanks, Irene. Dirk, what's your key takeaway?
Hiding in basements from the heat was a theme in my group, as well as there was a comment about the normal strategy of escaping to a movie theater during the heat dome, but pair that with COVID, and that was kind of off the table, right? Like, so these multiplying factors on health was one of them. Cost burdens to switch to heat pumps or those kinds of things is a concern.
Thanks,
fast enough? Yeah.
Excellent. I'm going to do one word. No, I'm just kidding. Our group talked a lot about other innovative, non-mechanical ways to keep cool. And maybe we'll share those out next week. And we also talked about how do you pay for this? And so we talked about the limitations currently of energy efficiency funding through like the Energy Trust of Oregon and other ways to fund this. So on-bill financing, grants, and bonds, and potentially PSEF. Okay, Vin, I'll turn it to you to sum up in less than 60 seconds.
Less than 60 seconds, all right.
Yeah.
Okay, so thank you everyone. Next meeting focuses on implementation, including covered buildings, which sizes are covered, compliance timelines. So we've been talking about this long range and what's in between the intervals, the process for setting standards, funding and financing building improvements, with consideration of anti-displacement, and then overall enforcement. How do we even monitor the compliance? We also will do the combined meeting. It's not going to be in person. COVID cases are on the rise. There's a weird cold going around right now. So our last meeting will be June 8th, 12 to 2:30. I will send out that invite tomorrow. Now we confirm we're not meeting in person. So thank you again. Thank you, Marty and Wing, for holding this space. And thank you all for participating. We'll see you in 2 weeks.
Thank you, everybody. Take care.